So thank you for joining me today as we give our latest update on our fight against COVID-19. From the beginning, I've had two main goals. Number one was to protect the health and lives of Oklahomans. Number two was to mitigate the impacts to our economy and get Oklahomans safely back to work. We are now 20 days into our measured approach to safely reopen our economy. It is time to work together to create the healthiest environment and the strongest economy for everyone in our state, regardless of your political affiliation. You know, we are Oklahomans. We believe in freedom, in courage, in respect, in compassion, and in the value of placing facts over fears. We want all Oklahomans to live healthy, prosperous, happy lives. I believe this is a common objective shared by all, whether Republican, Democrat, or Independent. Our shared belief in freedom transcends party lines or political disagreements. While the arguments and debates are abundant on how, I do think we are all aligned on the objective. Oklahomans have always pulled together in times of crisis. Now is the time to have alignment on two common objectives. Number one, beat this virus and protect the health and lives of Oklahomans. Number two, quickly revive our economy and give prosperity and freedom back to all Oklahomans. You know, America became the greatest nation in the world due to the courage and freedom of all those before us and our collective effort up to this point. It is time to stand on our courage and on our freedom. We need to preserve what has been so dear to all of us for so many years. Protecting this freedom is a responsibility we all hold. Therefore, we all have to get involved and do our part. As Oklahomans, we should be provided with accurate data, facts, and sound logic. Once armed with that, we can have the freedom to decide how to protect ourselves, our families, our communities, and our businesses. It is impossible to eliminate this virus from Oklahoma or from any other state. We must accept the fact that COVID-19 will be with us in some way until there's a vaccine. So how do we move forward? We have implemented actions to prepare necessary equipment, logistics, and hospital capacity to protect Oklahomans. To follow models based on what is happening in New York or New Jersey or Connecticut does not make sense for our state. As always, our decisions will be based on the data here in Oklahoma. This is why I instructed the health department to publish facts and ensure this information is communicated through multiple channels so Oklahomans can have a clear and unfiltered perspective. You can go to coronavirus.health.ok.gov and look up all kinds of data, even down to the zip code. In fact, our data has been given an A+ grade by national groups for its transparency and its level of detail. Let's talk about some of that data. We continue to hold steady with the 8th fewest cases per capita of any state in the country. Oklahomans, you should be really proud of your efforts that have made this possible to protect Oklahomans, yourselves, and our neighbors. When we look at the cases per capita, we know that that can also depend on testing rates. We are testing more people per capita than California, Georgia, and Florida. Yet our infection rate is significantly lower. California was one of the first states to go into total lockdown, but they have 33% more cases per capita than we do in Oklahoma. Oklahoma, we are now 20 days into our measured approach to safely reopen our economy, 20 days in. We have more than 4,600 hospital beds available for COVID patients, but just a fraction of them are in use. When we started phase one on April 24th, we had 306 people in the hospital. That's down from our peak of 560 back at the end of March. Yesterday, we had 218 people in the hospital, again, compared to capacity of 4,600 hospital beds. We also continue to increase testing across the state. Last week, we performed more than 25,000 tests, yet our percentage of positive tests continued to decline. When we started phase one, 6.3% of our tests were coming back positive. As of last night, just 4.8% of our tests are coming back positive. That means out of 1,000 tests taken, 48 are coming back positive, 952 are negative. I've heard some concerns that we're not testing enough people. But the World Health Organization says, and I quote, "Communities that see about 10% or fewer positives among their test results are probably testing enough." Our positive test rate is half of what the World Health Organization says is sufficient to give us an accurate picture. As of last night, we have just 932 active cases in our state of nearly 4 million Oklahomans. More than 3,500 people have already recovered from this virus. I think context is so important for Oklahomans to understand these numbers. So put it in a different way. In our two largest counties, less than 0.1% of the population has an active case. In Oklahoma County, there are 212 active cases out of almost 800,000 people. That means 99.973% of the population does not have an active case of COVID-19. In Tulsa County, there are 109 active cases out of 650,000 people. 99.983% of Tulsa County does not have an active case. Our data shows we are in great shape to move to phase two. In phase two, our safer at home order continues to apply through the end of May for Oklahomans 65 and older or who have compromised immune systems. We should all continue to maintain social distancing while in public and take steps to protect ourselves and others from this virus. Some of the highlights in phase two include resuming organized sports with proper social distancing and sanitation, resuming weddings and funerals as long as proper social distancing is followed. And as we continue with our recovery, it is important that we remember that coronavirus is still in Oklahoma. It's still in the United States. We will continue to take this seriously. And I want to remind all Oklahomans that now is not the time to take our foot off the gas. But if the data continues to hold, we will be able to move safely into the final stage of our reopening plan on June 1st. We are continuing to monitor this situation daily, and the state will continue to provide more guidance on phase three in the coming days. We continue to have plans in place for significant testing and contact tracing and the ability to respond with additional resources in all corners of our state. This includes Texas County and the Panhandle, where we have been providing support for the past few weeks. At this time, I'd like to invite Colonel Lance Fry. He's the state air surgeon with the Oklahoma Air National Guard, and a key member of our hospital surge plan to give an update on Texas County. Colonel?
Thank you, Governor. Good afternoon. Over the past several days, Seaboard has worked with the state and private labs to test more than 2,000 employees who work in Texas County. The state has also increased testing at the Texas County Health Department and deployed additional testing supplies to local providers in order to support testing among the general public with or without symptoms. OSDH also requested the support of the Trump administration and CDC in Texas County. And as a result, the CDC informed us this week it is promising to process an additional 3,000 tests for this area if needed. As a result, we're going to continue to see positive cases spike over the next few days, specifically in Texas County due to this significant increase in testing. For example, today, roughly 60% of the state's reported positive cases were in Texas County, 67 positives out of the 100 positives today. We also implemented the state's hospital surge plan. We deployed a OSU telehealth cart to the area to be used at the hospital in Guyman where COVID-19 patients have been being treated. The telehealth device allows for local certified physicians to have an open and consistent line of communication to a team of OSU medical specialists, including intensive medicine specialists, pulmonologists, cardiologists, and more. This expands the knowledge base for patient treatment without the need for transportation to more urban areas. Thank you. Governor.
Thanks so much for what you're doing. Keep us safe out there in Texas County, Colonel. Appreciate that. I wanted to give you an update on the CARES Act. We have set up a financial transparency team established to monitor and maximize every dollar from the federal government and make sure we will be providing daily updates to all Oklahomans. This week, I was excited to announce a bipartisan group of legislators to work with us on these projects. I've said Oklahoma is better when we all work together, and I look forward to working with my colleagues in the legislature. We're also working on a portal for local governments to submit their expenses for reimbursement under the CARES Act. We will have that stood up on Monday, and we'll share all the details with how our local communities can receive federal support in their fight against this virus. So I want to close with this. I want Oklahoma to be the first state in the nation to get its wings back and serve as an example of a community that works together, not against each other. A community that wins together, succeeds together, and thrives together. This is our moment to showcase Oklahoma's courage and freedom to the nation. Let's work together, let's lead together, and let's win together. So God bless you, God bless the great state of Oklahoma. We'll open it up to a few questions. I've also got Secretary Arthur here and Secretary of Health Jerome Lothridge.
Will Texas County also be moving into phase 2?
You know, I've got a call with the mayor of Guyman this afternoon, and we've always been supportive of our local communities to make decisions what's best for them. The local mayor has issued a state of emergency for his county or his city through June 6th, I believe. So we'll be working closely with them to monitor it. But we're putting this guidance out for the entire state, and but I'll be talking to him this afternoon to see if there's anything specific we need to do in his county, in his city.
The colonel said that 60% of today's cases were from new cases from Texas County. Is that all due to the outbreak in the processing facility? Is there a larger outbreak there in Guyman or Texas County?
You know that one, Blaine? You want to take that one?
I guess the big
Secretary.
Is there a larger outbreak there in Guyman and Texas County? Is it all related to this facility?
certainly, as we have more testing there in the facility, that's where we're going to see the spike in these numbers associated with those employees who are working there in the processing facility. But I think certainly to what the Colonel said, as you test more, you're going to see the spike there as we work through all of those employees there in the testing facility.
I've got a question about the numbers that are posted on the State Health's website. Do those include all types of testing that's out there, or now that we're doing multiple types of tests, or is that just basic nasal, or is every test that is processed posted on that website?
That's all types of testing that's posted there.
So last night approved a Medicaid expansion plan. What do you think of their funding mechanism, given that they're relying heavily on the shop and hospitals are struggling financially right now?
Yeah, I think about 67 bills. Our desk stayed open here at the governor's office till a little bit after 11. So we've got those bills. We're going through all of those, and haven't specifically seen how they funded the Medicaid.
Governor, what's your reaction to Commissioner Cox's letter? It wasn't a resignation, but it certainly had a tone of thanks for the memories.
Yeah, so I thought it was good. I was glad that Commissioner Cox sent that out. And again, I think when you look at what Oklahoma's done to fight this COVID virus, he gets a lot of credit. He's done a really good job of leading the health department. We've got our testing up. We've made some really good decisions. The data speaks for itself. So in the middle of this world pandemic, it's disappointing that we're going to be without a leader at the end of this month. And so I've said that before, but had tremendous confidence and thought he was the right guy for the job. And so we'll go back to the drawing board and we'll start interviewing others. But Commissioner Cox was qualified, and so I was glad he kind of got out some of his accomplishments there with that letter.
Governor, what are your thoughts on the veto override?
So again, that's kind of in the past for me, and I wasn't going to put my name on a budget that had $1 billion structural deficit. So I'm glad that's in the past. They overrode it. The legislature owns that budget. The facts are the facts, and so when we get to next year, which is 7 months away, we'll have that Board of Equalization meeting, and we'll be in here dealing with the 22 budget. I think I'm going to be proven correct that we've got some structural problems, and we should have addressed them this year, and instead of borrowing some one-time funds. So we've said that, but again, I've moved on, and the legislature overrode the veto. They own that. All of those folks that voted for that are going to have to answer to Oklahomans on why that was a good budget.
If I could just follow up, why the veto on the general appropriations budget as opposed to say a line item?
You know, again, this is something that I think Oklahoma is really important that they understand is that their governor, who's elected by all 4 million Oklahomans, had zero input in that budget. And so a couple people write that from certain areas of the state, and then they present it. So I wasn't going to put my name to a budget that we had zero input, and did not think that it wasn't the right way to plug $1 billion shortfall by grabbing road and bridge funds, because I believe Oklahomans want to be top 10 in road and bridge conditions, and to pull money from the pension funds, I just wasn't going to put my name to any of it. I wasn't going to get into the line item certain things. The whole thing needed to be vetoed.
With the way the budget played out, has your relationship soured with the legislature? Has it taken a hit?
I sure hope not. That's the way our founders wrote this Constitution, is that they have the right to write the budget, but they have to have the governor's signature or veto on it. Then they have the right to override it. So it played out exactly how it was supposed to. And I feel fantastic, actually. I feel great today. I have shared with Oklahomans my reason for vetoing it. The legislature disagreed with me, and they've got to answer to Oklahomans for that. And I'm happy to stand up every day and tell Oklahomans why I did it. But I have no hard feelings. I've got I think of them as my colleagues. We all should be working together. I'm not any better than the freshman House member from wherever. I really look at it that way. They're all my colleagues. They're my friends. So I'm not a politician, so I don't understand kind of the getting back and forth at each other. And so I'm just going to continue to talk to them, work with them. My door is always open, whether you're a freshman or you're the speaker, or whether you're the pro tem or brand new person in the Senate. It's the way I've from the very day when I was elected in January, or when I was sworn in January, I've walked these halls and built relationships with a lot of them. So I hope those relationships, they feel the same.
The relationships do seem a little rocky, though. Any plans to extend it out with Rancho?
Again, I think that when you say they're rocky, I think they're rocky with some of the leadership, but with the majority of the folks, I think it's fine. And it's time. I mean, I've reached out and had some sit downs with some of the leadership, and I need to continue to reach out, and I'll do that.
Back to COVID real quick. Is phase 2 going according to as it was written, or do you think it needs some tweaks before it goes into effect tomorrow, as far as taking something off the list?
No, I like the way it's written. I think, and what the big takeaway for Oklahomans as well is we're 20 days into phase 1, and we've continued to have that downward trend in hospitalizations, testing percentage. We've met all the White House gates. So that's what I told Oklahomans is, hey, the better off we do in early April, the quicker we can get to phase 1, the better we do in phase 1, the quicker we'll get to phase 2. So that's proven out well. We haven't seen any spikes. We haven't seen any leading indicators that would look like we're going to run out of hospital capacity. So I like where we're at. I don't think we should change anything. And again, I'm just presenting the facts and the data to Oklahomans, and I think Oklahomans are ready for reopen, and I think they're ready to move to phase 2. And if you we can always have arguments and disagreements about, hey, we ought to wait till we have 100 people in the hospitals. But if you remember, Mercy has laid off 1,000 people. A large hospital in Tulsa laid off 600 people. We're just not seeing the influx in the hospitals like we thought. My Medicaid reimbursements from our healthcare authority are down 15%. Just the folks aren't getting into the hospital. So we haven't seen the surge that some of those early modelers predicted. We've prepared, Oklahomans have done it, but it's time to move to phase 2. And Oklahomans are about freedom and courage and protecting themselves and their families. And I want to continue to give them that opportunity as we move forward.
How are we doing with antibody testing to find out, if someone was asymptomatic and maybe didn't even know they were sick? How are we doing with that? Where can we see some of those results?
Yeah, so we've got that antibody testing rolled out. We're doing some more statistical samplings around the state. We've done one specific sampling that showed up to 16% in that one sample had developed antibodies. Our early statistical sampling showed like 1.6% or 1.5%. So we're continuing to set up a plan to do that proactively across the state. Then we're also writing a contract to allow essential companies that want to do PCR testing and also antibody testing, that they're going to have access to do that as they're safely and measurably reopening their companies as well. We're doing that. We're doing the PCR testing out with the 2,000 employees out there in Guyman at the processing plant, and we're going to be doing some antibody testing there, doing that in the universities. So the antibody testing you'll see kind of ramping up over the next couple months.
A lot of people are interested in getting antibody testing. How do they go about doing that?
I'm Jerome Lothridge, Secretary of Health and Mental Health. At this point, antibody testing, as new as it is on the scene, isn't as widely available as PCR testing. Just to remind the general public, the PCR test is the dispositive test that tells you at any point in time if you are at that time positive or negative. That's the nasal swab test. Increasingly will be the saliva test. That's the test when we refer to the positive or negative. That's the one we're referring to. The antibody test was test for antigens. The antibody test tells us if an individual has been exposed to COVID virus. This is in more limited supply, although as the governor referenced, we're increasingly going to try to make that available in concert with companies, as an example, particularly those in the essential industries. That is coming. Folks should stay tuned for greater availability. We're contracting with individual entities to try to help increase that. But again, I would remind people that the utility of the antibody test is for surveillance at the population level. It's not a diagnostic. It doesn't tell an individual's positive or negative state. So we'll be using that increasingly, particularly for epidemiological purposes, and more to come on that in future days.
Can we go back to Texas County and just talk about exactly how many employees have already been tested and if you've gotten results from those tests yet? From this week?
There were over 2,000 tests done at Seaboard. The state health department went out and did a point prevalence survey where they tried to test as many employees as they could. We have not gotten all those results back. They've started coming in today. We haven't gotten them all back yet, so I can't answer the rest of your question.
You know what percentage we've gotten back? We're still waiting for most of them?
I think still most of them are still waiting, but they should be back within the next 48 hours.
Colonel, the big question I hear from folks, and it's just the response altogether, is there's concern that exposure you're getting because you're going into these places. What is your exposure rate to the men and women who are going into these places, who work under you? Have you seen some of them get sick?
We've actually had very good experience with not getting sick wearing our proper PPE. We have seen a rise in healthcare workers that are tested positive in the state, but in general with our testing people, we haven't seen a large increase.
Governor, if I could ask you a little bit about phase two, I think one thing that hasn't been brought up yet is bars to reopen. And as somebody who enjoys a good Tuesday happy hour, I was wondering what your recommendations, or Secretary Lawford's your recommendations for bar owners would be. Is there anything being sent out? Is the Department of Health or county health departments, trying to do some drop-ins to get some guidance? They'll come in and write you up if the bathroom's not well lit, but in this instance, is there any effort or extra guidance being given to bar owners or bar patrons who might be going back and saying, hey, this is my family, like we saw last night in Wisconsin, I think?
We have those guidance posted on our Commerce website. So we've worked with the health department to bless these different phases and kind of watch that data. And so the bar owners, just like the restaurant owners since May 1st, and the barber shop since the 24th of April, can see those guidances that we've laid out across for them to go get as they safely reopen. Churches, I get texts and emails and videos of the churches rolled out and did every other pew and created the social distancing. So they've done a great job. I have no doubt that some of the bar owners, as they safely reopen starting on Friday, will do the same thing.
Thank you very much. And this might be for Secretary Lawford, although certainly for you as well. We've heard a little bit about contact tracing, and that's a big step in this. I do know an individual who's tested positive, had a lot of symptoms, but he felt like he was interviewed, but nobody ever came in contact, traced him. I imagine that if somebody is hospitalized, that they are a first priority on contact tracing. I know, Governor, you were interested in having some flexibility for the health department to be able to hire more people more quickly. So where are we at the contact tracing, and what does that mean when you actually implement it?
Sure, great, thank you. As a reminder, the contact tracing is really the shoe leather epidemiology. This is contact with an impacted individual to find out whom she has impacted and to trace, as the name would indicate. The governor did authorize within the department an expansion of contact tracers. This is very labor intensive. So 150 individuals who had been trained already within the department were augmented by another 150 currently under training, and were further supplemented by members of both University of Oklahoma and Oklahoma State University's medical schools. And taken together with support from the National Guard, that numbered some 500 folks who are available for contact tracing. To the extent that proves insufficient, we have the capacity to add another 500 people by contract. As you've indicated, certainly there's an ordering of folks who are contacted. So for instance, out in Texas County in Guyman, there's an extensive contact tracing underway now. Where we have an outbreak, we'll certainly focus resources in that particular area. So I would anticipate that everyone will eventually be contacted, but more intensity will be placed on places that have a higher likelihood of outbreak.
And I'm not craving spreadsheets and data, but is there any, do you guys kind of have a report or kind of lay any of that out on how that's going at any point? You might help make it concrete.
Sure.
I'm not really sure what to say to people when they ask how that's going.
Right. We can provide some summary numbers. Obviously, each individual contact represents an individual with a name, a family, and the like, and so we would certainly preserve that anonymity. Nonetheless, we can certainly provide in coming days how many contact traces we've been able to conduct.
With the lessons we're learning in Texas County, Eastern Oklahoma has a lot of chicken processing things. Is there guidance that's going to be sent across state to other processing facilities like that in coming days?
We certainly have had lots of dialogue with all of our processing facilities in state, and that would include our poultry processors there on the eastern side of the state. So they very similar to Seaboard reached out to us early on in March so they could make sure that they were following that CDC guidance, that OSHA guidance. They did a lot of very proactive things to make certain that their employees had the appropriate PPE, taking temperatures before employees came into the processing facilities. So we continue, both the Department of Ag and the Health Department, to have very regular conversations with them. I think certainly the proactive steps that they took at the beginning of this situation, we have seen that be very positive for them because we haven't seen those challenges because they've made sure they've got PPE, found ways to do social distancing, which certainly in a processing facility can be challenging, but modified some of those workstations, providing extra areas for lunch breaks, making all the right decisions so that we could maintain that food supply, but also keep the health and safety of their employees as a priority.
Thanks, everybody.